This week will be the last week for a public inquiry in Ontario that was born of mass murder. So far, it's been 37 days of wrenching testimony into how on earth nurse Elizabeth Wettlaufer was able to kill 8 people in nursing homes over a decade without those crimes ever being noticed. Wettlaufer confessed. She's now serving 8 concurrent life sentences, but a lot is unresolved. An official report could be a year away, but some points have already been made forcefully. Here are a few. Chronic staff shortages.
When Ms. Wettlaufer would work an overnight shift, I just wanted to be clear about the number of residents she would be responsible for.
Helen Crombie was the former director of nursing at Crescent Care Woodstock. That's the home where Wettlaufer killed most of her victims.
She would be responsible for 90, perhaps 95 to 99 residents when she was employed.
One nurse for 99 patients. Incredibly, that does meet provincial regulations. Ontario nursing homes require only one registered nurse on duty at all times, no matter the size of the home. Medication errors weren't always reported. Of the 14 medication errors Wettlaufer made at the first home where she worked, only 6 were reported to the College of Nurses. Officials didn't share crucial information. One home wasn't told Wettlaufer was fired from a hospital for stealing narcotics. The college was unaware there were allegations of bullying or that she had already admitted to drug and alcohol addictions.
You're dealing with so many things, and you're trying to do your job the best you can. It didn't cross my mind that she was harming residents.
So John Lancaster is with us now. You cover the Wettlaufer trial. You certainly covered this inquiry. What's your best instinct about what we can expect this week?
Well, we're going to switch gears tomorrow. For the first time, this inquiry is going to hear from those most affected by these crimes, and that's the families themselves, loved ones, relatives. One of the key witnesses tomorrow is going to be Beverly Bertram. She is the lone survivor of Elizabeth Wettlaufer, the only one who can tell us in intimate detail of how she operated, the effects she had, and the lasting effects and the mistrust, the violation of what Wettlaufer committed.
You know, with an inquiry like this, people do a lot of listening, but they also want change. What's the chance that change will actually come? That's
up to the government. I mean, these recommendations are not binding. They can sit on some government shelf and collect dust, or they can be acted upon. We do know the new premier has promised 30,000 new long-term care beds for the elderly. That's on top of the 79,000 we already have. But oversight and money are the key things these people want. One of the most startling things I found in this inquiry was in Ontario, we're spending more per capita feeding prisoners in our jails than we are the elderly in some of these long-term care facilities. Again, oversight. We've learned Elizabeth Wettlaufer was the one who put an end to these murders because she decided she no longer wanted to kill people. She wasn't on anyone's radar, let alone police.
Yeah, no one stopped her. John Lancaster, thanks very much.
Okay.